So marijuana there's three distinct definitions that are important when discussing medical marijuana. The first one is marijuana, and it's the whole cannabis sativa plant. The second one is hemp, and that is the whole plant that has a delta-9 THC level below 0.3%. And the last is cannabinol, or CBD, which is the primary non-psychotropic compound in the cannabis sativa plant. And it is said that we have health benefits. Okay, for the historical landscape of it. We, starting from like 1600 to the 1900s, marijuana was used mainly for medicinal purposes. Now, going into the Great Depression and Prohibition, 29 states outlawed cannabis. And in 1937, hemp and marijuana were heavily taxed, and marijuana was mostly used for industrial and medicinal purposes at that point as well. So in 1951, there began to be strict punishments for marijuana and other drug offenses because of the Boggs Act. And in 1970, maybe the biggest thing that affected marijuana laws in Kentucky and the United States was the Controlled Substances Act of 1970, which classified marijuana as a Schedule I drug, which just means it had a high potential for abuse and had no medical benefits. So moving into the 1980s, you had the Just Say No movements and Executive Order 12564, which prohibited federal employees from using illegal drugs on or off duty. This all happened during the Reagan administration. And you also had the drug abuse resistance education, also known as DARE, put into schools and other programs, also during the Reagan administration, to prevent and help limit the amount of drug use by our nation's youth. Now, lastly, in this same time period, you had the Anti-Drug Abuse Act, which was meant to curtail drug use in the country. Next slide, please. Okay, so about 20 or so years later, you start to get more acceptance of marijuana in the United States. So you had the Cole Memorandum in 2009, which allowed which made it so U.S. attorneys were not supposed to, they were supposed to use the discretion when prosecuting medical marijuana in the United States. Now, in 2014, the Justice Department was directed to not interfere with the implementation of state medical marijuana laws. And 2014, also in 2014, you had the Farm Bill, which defined hemp as being any part of the cannabis plant that with delta-9 THC concentration at 0.3% or below. It also gave states the ability to adopt hemp programs and regulation, and it gave higher learning institutions the ability to research hemp. And then in 2018, you had another farm bill, which removed hemp from the Controlled Substances Act, and it legalized cultivation and commercialization of hemp. Next slide, please. Okay. So around 2018, Attorney General Jeff Sessions, he rescinded the Cole Memorandum, and he took the position that marijuana is considered a dangerous drug and any activity involving it is a serious crime. This position was more or less rescinded by Attorney General Barr and also Merrick Garland, who took the same position that was in the original Cole Memorandum. Now, in 2022, President Biden also issued an executive order that allowed all federal marijuana charges to be expunged or pardoned. Next slide, please. Okay, so the current national landscape, 24 states have allowed marijuana for recreational use, including the District of Columbia and Guam and other territories. And then as of right now, 13 states have at least passed bills to allow for marijuana to be used for medicinal purposes. Now, while 37 states have allowed medical marijuana or marijuana to be used recreationally, it's still legal in 13 states. Next slide, please. So it is important to remember that on the federal level, marijuana is still considered a Schedule I controlled substance, which, as stated before, it has no accepted medical use, has a high potential for abuse, and accepted for safety has a lack of safety for use not under medical supervision. It's unlawful to manufacture, distribute, dispense, possess, or use marijuana on the federal level. And as of right now, there's no FDA approval for medical marijuana. And I believe there's only 4 drugs currently that actually have been FDA approved that use any derivatives from cannabis. Next slide, please. Next slide, please. So in August 2023, the Department of Health and Human Services, they recommended that marijuana be rescheduled from a Schedule I drug to a Schedule III drug under the Controlled Substances Act. This is still being reviewed by the Drug Enforcement Administration, and while the Drug Enforcement Administration, they are bound by the recommendations on scientific and medical matters from the Department of Health and Human Services, they still claim they have absolute discretion on when to schedule, reschedule, or deschedule a drug under the Controlled Substances Act. So next slide, please. So just a few legal consequences if marijuana is moved from Schedule I to Schedule III. So it wouldn't automatically put all states' laws in compliance with federal standards, but it would allow marijuana to be dispensed as a prescription, which it cannot currently be done on a Schedule I drug under the federal standard. And for businesses, according to Section 280E of the Internal Revenue Code, marijuana moving from Schedule I to Schedule III would allow businesses to deduct business expenses on federal tax filings. Because many banks are federally insured by the federal government, they are currently not allowed to conduct business with marijuana companies. But if it is rescheduled, there's potential that at that point they would be. So that is just a general overview of the federal standard. I'm going to give it to Dan Zinsmaster to talk about Kentucky.
Good afternoon, everyone. Lira, Bryan, can you guys hear me okay? How about a thumbs up? Okay, perfect. All right. Yes, again, good afternoon. Dan Zinsmaster here. I'm a partner with the Healthcare Practice Group in the Columbus, Ohio office of Dinsmore and Scholl. I'm going to be talking about Kentucky's entrance into the medical cannabis arena. I've been practicing in this space since 2016 when Ohio joined the states that have authorized medical marijuana control programs. Although our program, even though it was created in 2016, it didn't come into operation until 2018. And there were certainly some bumps in the road on its way to becoming operational, and in the years since. Things are better here now. I am hopeful and optimistic that Kentucky's journey will be a bit smoother than what we had here in the Buckeye State. So next slide, please. Of course, to talk about the current Kentucky program, we got to first set the table a bit and provide some history about the journey to this point. 2014, I mean, you heard Bryan say a moment ago about the federal farm bill from 2014 and 2018. Kentucky had its hemp pilot project in 2014, which was a successful endeavor since its inception, and that authorized institutions of higher education and state departments of agriculture to engage in research involving hemp, and again, required licenses for those that were going to be handling, processing, or involved in the industrial hemp industry. Senate Bill 124, also from 2014, authorized and exempted from the definition of marijuana drugs that were used, FDA approved in studies and compassionate use programs, and the substance cannabidiol when recommended by a physician practicing at a state research hospital. Namely, this was for marijuana oil extracts for children with uncontrollable seizures and things of that nature. We had the Farm Bill. And then more recently, just in 2022, we had Governor Beshear's executive order, which allowed individuals and their caregivers to transport medical marijuana acquired in another state into Kentucky without facing legal consequences, subject to certain criteria. I'll talk more about that in a second. And then finally, more recently, from just this past year, Senate Bill 47, which is what legalized medical cannabis starting in 2025. Next slide, please. So talk a little bit about this executive order from November of 2022, because it is still in effect as of present date. That stemmed from Governor Beshear announcing in an executive order that certain individual Kentuckians or their caregivers could transport marijuana acquired from another state where it was legal, from a medical program, that is, back into Kentucky, again, so long as they met some criteria. This was done using the governor's constitutional pardon powers, and interestingly is a preemptive pardon, meaning that if you were to do this, which would otherwise be illegal, you will be automatically pardoned, again, assuming you meet the following criteria. And there are 3 criteria. 1, it must be purchased in a U.S. State where the purchase would be legal, and you must maintain a receipt of that purchase. The amount purchased and used must not exceed 8 ounces, which apparently is the difference between a misdemeanor and felony offense in Kentucky. And finally, the person must have a certification from a licensed healthcare practitioner showing the individual has been diagnosed with at least one of 21 different medical conditions. And so not only did this executive order have an impact on Kentuckians, but it also has an impact on states surrounding Kentucky, of course. Because again, while Kentuckians might be allowed to acquire and bring and use medical cannabis from another state into the Commonwealth, assuming they meet those criteria I just covered. Again, a lot of states do not allow non-residents to purchase medical cannabis in their states, Ohio being one of them. In Ohio, you would have to have an Ohio driver's license or government issued ID to participate in our program up here. But that's Ohio. Every state can be different, needs to be analyzed. And any Kentuckian interested in doing that under that executive order would need to investigate that further. Next slide, please. Okay, and this leads us to the big thing here, Senate Bill 47, which was passed almost a year ago now, and signed into law by Governor Beshear, which legalized the use of medical cannabis in Kentucky. It establishes a structure to regulate medical cannabis, including rules, guidelines, and standards for everything from dispensaries, which is where a patient would go acquire the medication, cultivators who are growing it, processors who are turning it into the form that it would be utilized by a patient, rules and standards for the practitioners that would recommend this as part of a healthcare modality to their patients, as well as rules and standards for the patients and their caregivers to participate and be involved in this process. Everything in any medical cannabis program, no matter the state, be it Kentucky, California, Nevada, Ohio, etc., a very strict regulation when it comes to this stuff. It's very, from seed to stem, everything is accounted for. Government likes to track every single thing and know where it is going, who it is utilizing it, and of course, the efficacy of those treatments. And Kentucky is no different with establishing these type of standards. Senate Bill 47 will also establish a process for licensing and the applications that would go into that process. Again, because you're not just going to be able to open up one of these entities without being licensed by the government. And again, while this was passed in, I believe, March of 2023, it's not something that goes into effect until January 1 of 2025. So we have some time before things will become operational, and obviously there's much to take place between now and then. Next slide, please. So this is just a sort of outline of what the program looks like and who it involves as far as agencies and participants. And again, it's intended to cover and allocate various functions, beginning with the Cabinet for Health and Family Services, who will implement, regulate, and manage this program in Kentucky. There is also a board of physicians and advisors who will assist the Cabinet in program. That board is made up of 7 physicians appointed by the Kentucky Board of Medical Licensure, as well as 2 advanced practice registered nurses appointed by the Kentucky Board of Nursing. Those appointees will have 4-year terms and are subject to legislative approval after their appointment. But then from there, we will see the licensing boards also have a hand in regulating how this is done. Through the standards and expectations imposed upon the practitioners, be it advanced practice nurses or physicians, who want to make this authorization, this recommendation to patients. So we will see standards of care and other guidance from these agencies about their license holders and what they need to do in order to comply with those expectations and standards. And finally, the Cabinet itself will pass rules and issue other guidance for various topics and types of operators and how they are to comport their businesses. And we'll get into that a little bit further. Next slide, please. So who are these operators? Well, I would say perhaps most prominently you have the cultivators, and that is the growers. Kentucky, like many states, is going to categorize them based upon canopy or grow space. And there will be limitations to what a license type and a license holder will be allowed to grow on site, depending on the license they pursue and are able to receive through the Cabinet. You will also have operators, licensed entities for dispensaries, processors, which, like I explained earlier, that is the folks who get the product from the cultivators and then transform it or create it into the type of product that would be utilized by a patient participating in the program. So they're kind of the middle person in between the dispensary and the cultivator. Kentucky actually has a term for producers, which is both cultivators and processors. Those of us in this industry or advisors to the industry know that many of the larger players and organizations around the country are vertically integrated operations. They like to do everything to leverage their skill set and expertise and operational costs and efficiencies. And so Kentucky already has a license created where a processor and a cultivator would be one thing, and that's a producer. You also have licenses for testing laboratories, referred to as safety compliance facilities. And again, you apply for a license, or an entity would apply for a license, and that could be denied for a variety of reasons that the department sees fit to deny for, based on non-compliance or insufficient ability to fulfill the expectations of the program. If denied a license, there would be a right to an administrative hearing to challenge the basis for said denial, although generally the burden is on an applicant to demonstrate sufficiency to hold that license and possess that license. The Cabinet is also required to create a uniform application form that will be used for this process. And I believe I read somewhere that upon receiving an application, the Cabinet will be required to approve or deny that within 45 days of receipt of the completed application. So that's a fairly quick turnaround from what most folks are used to in this industry, but assuming they can pull it off, that will, again, create a faster turnaround for getting these entities, hopefully, to a point of being in operation. Next slide, please. So what do prospective operators need to be mindful of? Well, again, like I said, every entity that's in this space, whether it's growing, processing, cultivating, testing, they're going to need a license from the Commonwealth. Licenses will be valid for 1 year. They will have fees attached to them. And I think I saw typical fees can vary from anywhere down towards $2,500 up to $50,000, depending on the type of facility, license, an entity is pursuing. Again, and not only where there'll be those initial application fees, you will have renewal fees every time that license needs renewed on an annual basis. All cannabis business licenses are subject to minimal standards, which will be enforced by the cabinet. And some of that will include things like making sure that all employees, owners, officers, board members do not have disqualifying criminal offenses, otherwise meet the criteria for an appropriate staff member, personnel, or owner. They need to be all adults. They need to avoid criminal histories. There will be other aspects about security that needs to be probably fleshed out in these applications. That is usually a very significant issue for expectant operators, that they will have to demonstrate sophisticated security systems to ensure and deter against theft and unauthorized access or entrance. Additionally, operators or prospective operators will need to demonstrate sufficient capital, and that doesn't just mean the cost of the application. These entities to build out are quite expensive. I frequently will get calls from interested parties who don't perhaps grasp the type of costs that go into the build out. 6 figures, oftentimes 7 figures, to bring a facility from inception to physical existence. And that is an expectation that when you are applying, you are going to be able to do this yourself as an entity. What they don't want, I've never seen this in any state, is that these regulators, they do not want people to basically apply for a license with no intention of acquiring and building the facility and then trying to flip that license for a profit. Most states have deterrents against that. We'll figure out how that's going to flesh out in Kentucky as rules and things come into existence. But those who are going to be pursuing licenses should be mindful what you put on paper. There's going to be an expectation that you're able and capable and intend to do just that. Next slide, please. So that's businesses and operators, but what about the patients? What about caregivers? Okay, well, let's get into that. Next slide, please. So how to obtain a medical cannabis card? Well, first and foremost, you got to visit a authorized medical cannabis practitioner. And that includes physicians, that includes APRNs who are authorized to prescribe controlled substances in Kentucky, who have applied to their respective board to be able to provide this written certification to patients for use of medical cannabis, which is unique, I think, because many states, they limit this just to physicians. Kentucky, they will allow physicians and APRNs to be an authorized practitioner for the purposes of attaining this authorization. But as soon as that's done, the provider has their authorization, they're able to start accepting patients, and then a patient presents, and they can get a written certification from an authorized practitioner. Once they get that certification, it is valid for up to 60 days, and it may be renewed up to 3 times for 60 days each time. There's an online application process for patients and caregivers, a registry portal, because there's a backend that they have to complete to register through this program so that they may upload their documentation that they have, as well as pay their application fee and obtain their registry card. And then voila, you got your card. You're able to go visit a dispensary and obtain recommended medication. There is this in-person the initial evaluation when you present to a practitioner who's approved must be in person, but after that, telehealth evaluations are permissible for subsequent evaluations. Again, so there is a particular process. And let's get into that. So next slide, please. What is this process for an appropriate practitioner-patient relationship? Well, at the outset, that means an initial in-person examination and assessment. So telehealth isn't going to suffice for the first visit, although down the road, that can be an acceptable type of follow-up encounter. But at first, it must be an inpatient visit. And then you must have a consultation between the doctor or the APRN and the patient reviewing medical history, the therapeutic and palliative benefits of medicinal cannabis. There must be discussion about the risks and potential side effects of the substance. I believe the provider has to check Casper to obviously run controlled substance checks to make sure, again, there's nothing at a red flag or aberrant in that history. And again, then there's an assurance that this is an established relationship, or at least that intention, and that practitioner will provide follow-up care. Kentucky, just like most other states, wants to avoid some sort of superficial system whereby practitioners are just rubber stamping certifications with no meaningful care or review of efficacy involved. That's to be avoided. And so providers, again, this is intended to be a meaningful program. So again, there should be a meaningful evaluation, a meaningful diagnosis, a meaningful certification, and a meaningful treatment plan, followed by further review down the road of the efficacy. Because like any medication, you want to make sure it's working and not being harmful. And that needs to be documented in medical records. Upon all this happening, the physician or the APRN can certify that the patient has an acceptable qualifying condition. Next slide, please. So, even though that executive order I talked about earlier listed 21 different conditions, Senate Bill 47 has much less. Basically here, the medical cannabis program, pursuant to Senate Bill 47, has qualifying conditions that include cancer, chronic severe pain, epilepsy, multiple sclerosis, chronic nausea and vomiting, and then PTSD. A much more limited array of conditions to qualify under this program. But there is the ability to expand that list. So the Kentucky Center for Cannabis, they may review conditions and diseases, and if they believe medical cannabis would be an appropriate modality for that condition disease, then they can add that to the list of qualified conditions. In Ohio, that's done by our medical board here. They have approved a handful over the last 5, 6, 7 years. But it's, again, the science is still pretty new. And so you don't have a lot of evidence-based medicine to say, we know this works for this, we know this works for that. So it's been slow going to add new conditions, but again, it can happen. And in Kentucky, that will happen pursuant to the directives of the Kentucky Center for Cannabis. Next slide, please. So in addition to qualified patients, who else can acquire medical cannabis in Kentucky? Well, one, designated caregivers, meaning adults in Kentucky who, again, don't have disqualifying felony offenses, meaning a felony act of violence or a felony drug offense. But they can be a registered caregiver. They can be a registered caregiver for up to 3 qualified patients to go and acquire medical cannabis for these qualified individuals. Again, a lot of patients might not be able to ambulate, might not be able to get in a car and drive a long way to a dispensary or whatnot. And so caregivers can go acquire that on their behalf and then bring that back to the qualified patient. In addition to designated caregivers, Kentucky has a provision for visiting qualified patients. So non-residents of Kentucky can participate in this program, which I find to be unique. But of course, it needs to be done, in a way that's compliant with Kentucky law, but assuming it's followed. If somebody's having an extended visit in Kentucky and needs to acquire medical cannabis there, they will be able to do so, again, assuming they are otherwise compliant with the standards expected in the Commonwealth there. Next slide, please. So what limitations do patients need to be aware of and their caregivers? Well, a patient may have up to a 30-day supply in their residence or a 10-day supply on their person. There is an exception where a practitioner could authorize a greater amount if they believe a 30-day supply is going to be insufficient. But again, that's going to require some analysis and documentation to support that. If it is not kept in the residence, the medical cannabis that is, it must be kept and maintained in the original container it was purchased in. So no, medication bottles and purses with all sorts of different stuff in it, as some folks might do, or transfer it into a baggie or something like that. Again, if it's not in your home, it needs to be in the original container. Cannabis cannot be within a driver's reach while operating a motor vehicle. Home cultivation is not allowed. So home grow is not acceptable, even if you are a qualified patient. There are limitations regarding the potency of THC that will be in medical cannabis, as articulated on the slide here. And again, patients cannot and should not do any task under the influence of cannabis that would be considered negligent. So again, avoid operating heavy machinery. Don't practice medicine if you're a physician or a healthcare provider who is receiving medical cannabis, and don't do things under the acute effects of cannabis, which again is really no different from any other type of controlled substance. If it can impair your judgment, including motor skills, things like that, you need to be mindful about when you use and how you use it relative to your professional endeavors to avoid again, negligent situations or acts of harm. Next slide, please. Some other limitations I want to note. Again, physicians and advanced practice nurses authorized to provide a certification. If they're doing that, if they're certifying patients as qualifying for the program, they are not also able to have an ownership or investment interest or compensation agreement with a licensed cannabis business. And the reason for that is to avoid conflicts of interest, obviously. Other aspects of note: health insurance, workers' comp, governmental medical assistance like Medicaid. Medicaid does have to reimburse for medical cannabis costs. And I'll draw a distinction to the federal level, which Bryan talked about earlier. It's illegal federally, and therefore CMS has stated relative to Medicare, again, to provide patient safety, drugs and biologicals must be controlled and distributed in accordance with applicable standards of practice consistent with federal and state law. So again, a patient who receives a medical cannabis diagnosis and treatment in Kentucky can't have Medicare reimburse the costs. Medicaid, different. Medicare, distinctive from that. So be mindful of that from a healthcare entity or practitioner standpoint when it comes to reimbursement of costs. Finally, employers may still choose to retain drug-free workplace policies. Again, employment law issues will be covered in just a second by my colleague Lira, so I'm not going to dive into that any further. But last slide for me, if you can go to that. So again, following Senate Bill 47, what else is on the horizon? Well, we have pending legislation to expand the list of qualifying conditions. We also have pending administrative rules to fill in the proverbial blanks as to how this program will operate and hopefully flourish once it comes into existence here, this coming January. So we got to fill in the blanks. Everyone's hopeful that it will be a flourishing treatment modality for healthcare providers and for their patients. Again, but like always, this is something that moves and shifts quite rapidly. And so everyone and anyone should be mindful of these developments and keep an eye out for things to occur between now and next January. With that, I appreciate your time. I'll turn it over to my colleague, Lira Johnson.
Thank you, Dan. And good afternoon, everyone. Thank you so much for joining us for this, probably the first of more than one of these sessions that we'll have to help our clients understand as medical cannabis becomes legal here in Kentucky. I'm an employment lawyer and I represent just employers, not employees. And my clients range from manufacturers to healthcare providers, small and large, and many of them are federal contractors and subcontractors. Many of my clients are in heavily regulated industries, and all of my clients here in Kentucky are concerned about how this change in the law that starts next January will affect their workplaces. And so you just heard Dan talking about all the ways in which an individual can legally acquire permission by prescription to have access to medical cannabis. And now I'm going to tell you about all the ways that an employer can put a stop to that. Because Kentucky has a rather unique approach to this. It might have stemmed from the fact that medical marijuana was introduced in the Kentucky legislature multiple times and not passed. There was a big struggle between our very pro-employer manufacturing segment, as well as our healthcare employers here in the state, concerns that they raised very validly about how this would impact our workplaces and our safety here in Kentucky. And so the legislative compromise was to create all of the framework that Bryan and Dan have described to you, but then to say, on the other hand, when it comes to the workplace, that the employer has a wide variety of options. And we'll talk about those in a little bit more detail, but the employer can essentially bar employees from using medical marijuana, unlike any other type of medicine you might imagine. You can have an employment contract that specifically forbids people as a condition of employment from engaging in the use of medical cannabis, to allowing it. Employers may also choose to allow it, and the conditions under which they allow it are for the most part left up to them. So we're going to just spend a few minutes to talk about what the law itself says, and then what employers should be thinking about as they plan for this to go into effect next January. So the law says that an employer may lawfully prohibit its employees from using medical cannabis as a condition of employment. And of course, in order to demonstrate that this was a condition of employment, the employer is going to want to have that in writing, disclosed very clearly, and most likely would like to have it advertised to new applicants, because an employer doesn't want to go to all the trouble of advertising and securing employees only to have them quit when they learn that they've got to sign an agreement that says they cannot use medical cannabis as a condition of employment. The Kentucky law also allows the employer to discharge an employee who's found to have violated that promise as a condition of employment. And it goes so far as to say that the law itself will not create a claim under Kentucky law for wrongful discharge or for discrimination by an employee who is discharged on the sole basis that they have used lawfully used medical cannabis here in Kentucky, as long as the employer has made it clear that as a condition of employment, that's something that they should not do. So that's one extreme. And employers who are thinking about planning for next year really need to grapple with the question of, are they going to prohibit this use altogether? And if so, how will they communicate that? How will they enforce that? And in making that assessment, employers need to look at several different things. They need to look at what types of work they do there in their workplace, as well as what kind of contracts they have or grants they may have that would limit their ability to allow something that's a federally illegal drug to be used in their workplace. And that's going to be a case-by-case analysis. To some extent, it's going to even vary job to job. Some employers may have jobs where quite literally federal law would prohibit a commercial truck driver, for example, from being able to have medical cannabis that's legal in Kentucky. And an employer can't change the federal law. So to the extent that you employers know that you have federally regulated jobs, and those regulations prohibit the use of any Scheduled I drug, as long as cannabis stays on Schedule I, then it's not an option. You're going to need to continue to enforce prohibition against using all Schedule I drugs, including medical cannabis in Kentucky. Next slide, please. Employers can also and should also consider what type of written drug policy, drug use policy, and drug testing policy they would like to implement at their workplace. And almost all employers here in Kentucky have a written policy on drug testing, drug use, prohibiting use. It's really common here in Kentucky to have a policy that requires applicants to be tested prior to being able to start work. And if they fail a drug test that includes all the Schedule I drugs, to rescind a job offer. And it also is really common for employers to have a policy of testing employees, at least here in Kentucky, if they appear to be impaired. So this law explicitly says that the employer can prohibit employees from working while impaired and also can assess what work they will not be allowed to use or to do if they have a medical cannabis card. So for those employers that don't have a written agreement or a clear policy that no one can be employed and use medical cannabis, they can, one alternative is to place certain work that's not otherwise limited by law from employees who would have a medical cannabis card. They can place this work off limits, and they can simply say that you must declare if you have a medical cannabis card, and if you do, you cannot operate specific equipment, power tools, and so forth that would pose what the employer believes would be an unreasonable safety risk. So if you're an employer who's considering not particularly banning all employees upfront from being able to use medical cannabis, this is an option to seriously consider, and also to understand that it will take some work for an employer to create the documentation to show which tools have been determined in advance to be an unreasonable safety risk and why, and what the process would be for an employee who had a medical cannabis card but wanted to apply for work, what the process would be for that employer to screen those people from those jobs. Remember that other laws prohibit employers from asking about disabilities that an employee may have at the initial stages of the job. And so that's going to be something that needs to be handled carefully so that an employer doesn't accidentally trigger the laws, the prohibitions on laws asking about disabilities when inquiring about medical cannabis cards. And finally, this law, unlike some states, Kentucky's law explicitly says that employers can use their own good faith judgment to determine the impairment of an employee who has a medical card if the person is at work and appears to be impaired for any reason. And then the law goes on to even describe in a little more detail how good faith determinations would work. Next slide. So the law specifically says that to make a good faith determination of impairment, the employer should first assess the behavior of the employee, and essentially this seems to mean observing signs of impairment and documenting those, I might add. And then as step 2, testing for the presence of marijuana using established methods. That I'm saying that in quotes because that's what the statute says. It's rather vague what the established methods are, and perhaps a regulation will be developed that explains what those would be, which would be helpful for employers. We can test for the presence of marijuana, but it's extremely hard to test for impairment. And this is why the good faith determination is so important and why it's been included in the Kentucky law. Because the tests that exist today can determine whether or not there's been the presence of THC, or sometimes, depending on the test, it might confuse that with another cannabinoid that's legal, for example, CBD. And those tests simply show the presence of something. They don't show when it was ingested. They don't really even show how it was ingested. They don't show how they might affect the motor skills of the person who ingested it. And so unlike testing for impairment under alcohol, for example, where there is a state law that literally tells us what level of impairment, what level of blood alcohol content equals impairment, there is no such national standard. There's not even a medical standard at this point. And scientists are concerned that they're not going to be able to quickly develop something that will show anything more than somebody used marijuana. The two most common tests that are used in the workplace are a saliva test and also a blood test. And the saliva test has come a long way. It's considered to be quite reliable, and many people think it's more reliable at testing recent use rather than blood tests. But there's not a lot of scientific evidence that proves that. So back to testing for established methods, I guess this means that you'll send someone with a driver over to a place where you'd ordinarily send them for testing for impairment. We have several of those around the Louisville area where I live. And then they would be tested for the presence of marijuana, and that either test positive or not, there can be some concentrations that might be reported depending on the type of test that they're given. And then the employer is going to have to put together the step 1 and the step 2, what they observed, and then what they saw in the test to determine if they have a good faith belief about impairment. And that's why the behavioral assessment in step 1 is super important. I can't stress this enough. And it's important for our employers out there to be thinking about developing training for supervisors and first line lead folks on what behavior do we look for if we're concerned about impairment? Can we develop a check sheet for that? Do we have training on that? Can we show what we would consider, given what our workplace is like, what we consider to be an impairment behavioral assessment? Will we have one person that's in charge of giving these assessments and so forth? So you can see that there's a lot to be thinking about as you put together a policy for this. But if the employer does determine that impairment exists, then the burden goes to the employee to try to refute that. And I can tell you, having already gone through this before medical marijuana was legal, employees will come up with a lot of things to try to refute it, including studies that are published at the National Institutes of Health saying you can't show when somebody ingested it, you can't show whether or not they were impaired, and you can't necessarily even show that what they've ingested is marijuana. It might have been something else. And so there's just a number of things where I can see step 3 might be a little harder than some employers might wish it to be. Okay, next slide. So the other thing that employers in Kentucky have in the statute is an assurance that if the employee is fired for violating the terms of their employment contract, which says they will not use medical marijuana, or a workplace drug policy, and they've tested positive for the controlled or banned substance, or they were found to be under the influence at work using the good faith method, that the employee should not be able to collect unemployment benefits. And so all of you who are employers out there are very familiar with the Kentucky unemployment benefit system, are going to know that we want to have everything documented. We want to have documentation of the employment contract, the policy, the test, the chain of custody for the test, what the test results were, and of course, documenting what we saw at the behavioral assessment stage in order to defeat an unemployment claim. Next slide. So I want to just emphasize that everyone now needs to really review and assess what they'd like to put in their workplace drug use policy, their testing policy. You also want to review and update your written job descriptions. If it's a job like a commercial truck driver that requires someone to meet the federal standard for drug testing and therefore they cannot use medical marijuana, then that should be in the written job description. That should be clearly communicated when you're advertising for the position. That should be something that the applicants know about upfront to save everybody time and money. And then employers also want to review and assess what they're doing with their workers' compensation insurance, because Kentucky has a statutory program that gives a guaranteed discount for workers' comp coverage to employers that have implemented a drug-free workplace program that includes drug testing and other things, which is administered by our workers' compensation division. And then last but not least, everyone needs to review and assess the contract terms that they have as a business. Have you already entered into contracts as a business that require you to prohibit your employees from having medical marijuana or some version of this? And this is especially true for federal contractors and subcontractors who are subject to special terms and conditions, as well as federal grantees who have special terms and conditions in their grant agreements. And then I'm not going to go through all these slides, but if we could go to the next slide, there are many, many people out there who have contacted me to say, what if, as a Kentucky company, we would like to consider how to allow people who really need medical marijuana? How would we go about creating the right policy and procedure for allowing somebody to actually use medical marijuana at our workplace? Maybe we're an office. We don't have concerns about moving machinery, and we are concerned that some people really could use this as they go through cancer treatments. Or maybe they are a business that already has had people who've been prescribed one of the 4 drugs that the FDA has approved that would cause an employee to test positive for marijuana if they had a blood test or any kind of a test as part of the regular testing process. So employers are wondering, how do they take this into account? And so I've made a suggestion here on this slide of ways that an employer could develop a policy by considering 7 different steps of how to implement it. And it's most likely that the employer would not have the same policy for all jobs. Most employers are going to have some dangerous jobs that involve, driving a vehicle or operating heavy machinery, even in an office. And so it's more likely that the employer is going to be determining on a job by job basis or a facility by facility basis whether they can choose to accommodate medical marijuana. And so the last thing I'd just like to leave you with is that, remember, under the federal law as it exists today, the ADA does not require the employer to allow medical marijuana use, even if it is allowed at the state. That's because of the way that the ADA has been written and interpreted and applied here in Kentucky, as well as the law itself. This law itself says that an employer need not accommodate, if it chooses not to accommodate, an employee with a medical cannabis card. So employers have a lot to think about, because the burden is now going to be on you employers to decide where you fall on this continuum and to have the appropriate documentation in place by January 1st of next year, and a process and a procedure for making that work in your workplace. So with that, we wanted to save a few minutes in case people had questions, and I know Autumn's monitoring the chat. There's a few more things here that we'll probably cover next time around when we have more information out there, perhaps in the regulations, and a little more time to go into what employers around the state are doing. Autumn, do we have any questions from the audience?
I don't see anything in the chat right now, but if you have something, feel free to send a chat directly to me, Autumn Man, or to everyone, and we'll see if we can get some more information for you.
So I see a question from someone about they'd like to get a copy of the presentation. And so we would encourage anybody who wants to get a copy of the presentation to contact one of the presenters, or when you fill out your evaluation form, to put a note in there indicating that you'd like to get a copy of the presentation and how we can get it to you by email.
All right. And Lira, if I can add something to our audience, we're interested to know what's on your mind as again, whatever angle you may be interested in or looking at these issues from. So as far as suggestions for future programming, additional supplemental webinars, we're all ears. We want to know what you're interested in. Obviously, today was a general overview to set the table. You could go into the intricacies and spend hours and hours going through that. But that wasn't for today. But it can be for another day if you let us know what it is that is attention grabbing and of interest. We would certainly be all ears and inclined to aid in that educational programming as well. Oh, we got an employment question here, right? So I'm going to
Yeah,
let
so
you take that.
I did see somebody ask about they're looking for more information on how to test to get a good sense of impairment. And, I think whoever develops that test is going to be a bazillionaire because I think that while many of our labs are working on that, the tests have always been focused on just detecting the presence of THC and not detecting any kind of impairment. And as we talked about before, it's really difficult to measure impairment on a simple, straightforward test. Perhaps just because science hasn't studied it long enough to get baseline information about what would be impairment for different sizes and ages and genders of people. Oh, great. We have another question. As far as the testing process, can you ask for a medical marijuana card if the employee tests positive for the presence of marijuana? So this is a great question to think about now because it's how you build your testing policy since you have so much freedom here in Kentucky as a Kentucky employer. So typically how it works with all other drug testing, and we encourage you to have a policy that explains this clearly to employees, is when you are selected for a drug test, the employee fills out a form and indicates all of the prescribed medications that they are taking. This is what happens today before medical marijuana. And all those prescribed medications are listed and then taken into account and given to the testing facility. And the testing facility then runs the test and can report back, kind of depending a little bit on the relationship that the employer and the testing facility have, but can report back on presence of something, but prescription for it. So it's not at all uncommon for people who are prescribed opioid pain relievers to declare that, show the prescription, get the test comes back positive for, guess what, the thing they were prescribed. And so it's important to be thinking in advance as an employer about how will we address this in our policy? Will we have people declare that they have the card if their card is valid? Can we simply say, well, we excuse this? This is, that's going to be for you to write into your policy. So think about those hard questions now and determine what's right for your business.